Hello again. It's Rockson Liu from Emeryville, California, a dedicated hernia surgeon. Today I want to talk to you some more about picking your surgeon. I talked about how to look them up on online and looking how to look at reviews, etc. What questions to ask your surgeon when you meet them. What are some important things to look for? Um, Today I want to kind of address the I guess the experience, the skill, the background of the hernia surgeon, what differentiates one hernia surgeon from another hernia surgeon. As a again, as a complex hernia surgeon, I see a lot of patients who have complications, and they entrusted themselves in a surgeon, and it could be a dedicated hernia surgeon and still had a complication. Um, and like I mentioned before, most complications happen with what happens in the operating room. So, how do you really know what that surgeon is capable of doing in the operating room? This is a very, very big topic, and it's kind of hard for me to cover everything. So I'm gonna kind of talk about what comes to mind, and I'll probably have more videos in the future to supplement this one. And I think I'm gonna probably upset a lot of surgeons with what I'm gonna say, but I really feel like there's too much. Uh, how should I say, misinformation out there generated by us surgeons. There's a lot of marketing going on, of course, because everybody wants business, and it's so easy nowadays to for people to market themselves as a hernia surgeon, right? So, from a marketing standpoint, surgeons can be very effective with marketing, right? You can have a very nice website. You can have kind of patient-facing videos like this. You can make yourself seem like a expert, right? Just through the website. So, as a patient, how do you know for sure that that surgeon is really good at what they do inside the operating room? And that's a very, very tough thing for to figure out because, again, there's no hernia registry. There's no objective way of identifying how good that surgeon is. Um, Insurance companies do have that information. I understand that some insurances do publish a list of surgeons that are very good in their system that basically have very low complications because insurance companies know when patients have complications, right? If they have a complication, the insurance company has to pay for extra visits, extra surgeries, etc. So the insurance company have some skin in this game, and so they're going to tell patients who the best surgeons are. So that's a pretty reliable way of finding out. But not all surgeons take insurances, right? Like for example, I am out of network for a lot of insurances, so I may not show up on the list. And but I know I'm a very good surgeon. But you may not see me on the list for your insurance carrier. So that's not 100% foolproof way, but I think it's a very good way to find out how good your surgeon is. There are a lot of surrogates that are used, like which hospital, which academic center is a surgeon at? Are they at a name brand center? I can tell you, when it comes to robotic surgery, especially with the Da Vinci, when I started in 2014, the academic centers were like, they were mad whenever I talked about doing robotic hernia surgery because they felt like there was no place in the hernia world for robotic hernia surgery except for maybe the really complex stuff. Um, Even in 2020, I would say, a lot of them were still very upset about me going around telling other surgeons how great robotic hernia surgery is, especially for the more straightforward stuff. Because, with robotic surgery, I'm so precise with how I manipulate the tissue. I am so perfect with the plane I'm in so that I don't get into the plane where the nerves are. I leave a microfascial layer over the nerves. I can dive deep into the what I call the what's called the retropubic space, the space between the bladder and the pubic bone, to tuck my mesh in vertically there so that it doesn't get pushed into a direct hernia. I mean, there's so many technical nuances that the robot makes easier that it, to me, from day one was very obvious that the robot was just such a good tool for hernia surgery. But the academic centers did not believe in it. It wasn't until around the time of the pandemic when they were, I don't know what it was, but maybe they were able to watch more videos, or I don't know what it was, but after the pandemic, the academic centers started really believing in the robot, but they were 10 years behind, right? So like I had mentioned in the other videos, right? How quickly can they catch up? Are they doing, 50 cases a month to catch up and develop the skill set? Whereas I've been doing several hundred cases a year for 10 years now, right? So I'm way ahead of the game compared to the academic centers. So I would say the academic centers nowadays are pretty far behind with robotic surgery. So the brand name is not an indication of how good the surgeon is. Now, if I were hired by, let's say, a brand name, a big caliber academic center across the bay, then that's a different story, right? Because I had that background of doing a lot of robotic surgery and I'm being hired for that skill set. But just because a surgeon is at a big academic center doesn't mean that what they do in the operating room is very good. In fact, recently I was out proctoring, and I found out that this very well-known hernia surgeon spends 4 hours doing inguinal hernia. It takes me about half an hour to do an inguinal hernia, so it's very different, right? So what happens in the operating room is really cannot be tied to the brand of the academic center. Okay. How another surrogate that is looked at quite often is how many publications the surgeon has, and I guarantee you that is the poorest surrogate for how good a surgeon is, because there are lots of surgeons with hundreds of publications, and again, I would not let them touch my family because they have not been on the robot. They maybe use a robot for really complex stuff and aren't really good at robotic surgery. The robot doesn't do anything on its own. It's not like I go and press a button and the robot does a surgery, and so it doesn't matter who is sitting behind that robot. Every movement of that robot is controlled by me, okay? So as you can imagine, the surgery goes as well as my skill set, okay? If I am very rough with the robot and I tear things, it's still gonna get bloody, right? If I don't know how to use a robot because I'm not very facile with it, my movements are very abrupt or very big, I'm not very delicate, I don't have the finesse, then I'm still gonna tear the tissue, right? I'm still gonna traumatize the tissue. In fact, I see a lot of surgeons who they use laparoscopic technique, and there's a lot of pushing and smearing, and they end up pushing into the nerves, right? The nerves are in the back, and to dissect the tissue, they're constantly jamming the robot, and the robot's really strong. And every time I watch these, I cringe because I know that patient's going to hurt afterwards, right? The testicular vessels and the vas deferens in guys, those are very delicate structures. If you pinch it with the robot instrument, which is really strong, you're crushing it, and you're going to get that kicked in the balls feeling. And I just cringe every time I see that, and I just, but that is actually a very common issue that I see in robotic surgery. And so just because this surgeon has hundreds of publications doesn't mean that what they do in the operating room is very delicate and very precise with a lot of finesse. So publications really is not a good surrogate. How many online videos they have like this talking to you, right? This is free. This is easy to do. This requires no skill. So I can talk as much as I want and sound like an expert. And as surgeons, we're trained to sound like experts, right? We're trained to use big words. We're trained to talk about very nuanced, specific stuff because we do have a lot of knowledge. You don't get into medical school if you're not super smart. You don't finish medical school if you're not super smart. You don't finish residency if you're not super smart and articulate, right? You don't finish fellowship if you're not super smart and articulate. So every surgeon is super smart and articulate, right? But how good are their hands, right? I can tell you, surgeons with average hands graduate from medical school. Surgeons with average hands finish residency. Surgeons with average hands finish fellowship. Okay, so just because they sound articulate and sound very smart doesn't mean they have really good hands. Okay, but a surgeon who is dedicated to hernia surgery takes the time and sits down and talks about hernias and creates online messages for patients and blogs, etc. Cares about hernias and knows a lot about hernias, which is very important because it's not just the technical aspect of surgery that's important, but also the judgment, right? So how good is a surgeon's judgment in the operating room? When I like to, when I'm teaching other surgeons, I like to say that, even the simplest surgery requires hundreds of thousands, if not millions, of decision making, right? When I start dissecting the tissue, I can pull the tissue in many different directions. I can pull with different strengths, right? And where I can cut in many different places, right? If I'm a millimeter off, I may be in the wrong plane, right? So every single step of the operation is many decisions, right? So I'm making millions of decisions in even a very simple operation. Imagine if it's a complex operation. I mean, we're talking about trillions of decision-making points. And if I don't have good judgment, if I don't have experience being in the operating room in those situations, then even if I'm a technically gifted surgeon, I may have trouble, right? So the surgeon who talks a lot about surgery, who spends time immersed in hernias, they probably have pretty good judgment, which is very important. Okay, surgery videos. Okay, so videos are very common now, and it is really because of the Da Vinci robot. When we were doing mostly laparoscopy, there were very few laparoscopic videos because the laparoscopic video was held by a person, or the camera was held by a person, and there was always a lot of movement, a lot of shaking. The scope is held by the robot, okay, so that it's very stable, so we can create beautiful surgical videos that are very stable, that demonstrate the surgery. And we can speed it up even to 4 times the speed. It's still watchable. So there are a lot of surgery videos out nowadays. So one thing you can look at is if you can stomach the videos, or maybe have a friend who can watch these videos. Watch the surgery videos. Watch and see how precise the surgeon is, how bloodless. I mean, you may not know what the surgeon's doing because, of course, it's surgery and you're going to go through residency to learn how to do surgery, so you wouldn't know what the surgeon's doing. Look at how much blood there is, right? Can the surgeon move quickly? Now, I'm not talking about quickly because the video has been sped up, but just moving through the parts of the operation quickly without blood. At the end of the operation, how much blood is there in, let's say, an inguinal hernia at the pocket, right? If it's let's say, ETEP or Robotar, how much blood is there? How fast do they speed up the video? If all their videos are 4x, maybe that means they're really slow. And so they want to make it look like they're really fast and very, very dexterous, right? So if all their videos are 4x, can you find a video that's normal speed? If you can't find a video that's normal speed, then be careful, because that surgeon maybe takes a long time, and that means you may be under anesthesia for a long time, okay? And then how many surgery videos do they have? Do they just have one, right? Okay, maybe they tout themselves as, I presented, at SAGES, or I presented ACS, or I presented this hernia meeting, that hernia meeting. Okay. Well, these presentations are usually 5 to 7 minutes. You don't have to, you can be a really bad surgeon, but pick out very good, beautiful parts of the operation and stitch it together, make it look like your surgery is like the best surgery ever. But how many videos does a surgeon have online, that are full length or almost full length, or show quite a bit of the surgery without any splicing or cutting, right? Um, if a surgeon is proud of what they do, they would probably teach through videos. YouTube is a very good platform, because if we anonymize the video, you can't tell who the patient is. So I think it's very safe from a PHI standpoint. But yeah, let's see how many videos a surgeon has. So, you may read reviews, maybe you talk to the surgeon, maybe you look at their credentials and they may seem like the perfect surgeon. Go and find their videos. If you can't find any videos, be careful, because the only evidence of what they do in the operating room is the surgery videos. That's like the black box of the operating room, right? What actually happens in the operating room, nobody knows, right? Maybe the OR staff, if you're lucky, an OR staff who's in the operating room with that surgeon. Otherwise, you have no idea. But the surgery video is a window into that. It's like the black box. So if you can't watch the surgery video, I'm sure you have a doctor friend, maybe a surgeon friend, even an orthopedic surgeon or neurosurgeon. Have that person watch the surgeon's video and say, hey, how's their technique? One thing to watch out for is a good operation is done really by how well the left hand, the surgeon's non-dominant hand, retracts the tissue. Okay, how precise that retraction is, and I like to say how much cotton candy areolar tissue, this cobwebby white stuff, is there. So have somebody who is, if you have a professional, a surgeon friend who can watch a video, have them watch that video. If you can't find any videos, then that's also a clue that maybe that surgeon has something to hide and is afraid to show what they actually do in the operating room. And you gotta question how good that person is in the operating room, because again, your surgical outcome is tied to what they do in the operating room. I would say 80% of your surgical outcome is tied to what they do in the operating room. The other 20% is what they do before surgery, and we'll talk about that. There's a concept called prehab or preoperative optimization, which is important for certain hernias, not for all hernias, but so that would be the 20%, maybe even 10%. It's not a very big number. Okay, so hopefully this video will give you a little bit more insight into the surgeon that you're picking, because again, at the end of the day, the surgeon is extremely important. It's not the front office staff, it's not the Google reviews, it's not how they look, it's not how much they charge. And I'm going to get into the charge aspect later, because I think people miss the forest for the trees, or miss the trees for the forest, miss the forest for the trees. Sorry, I wasn't born in this country. I was born in Taiwan. Grew up in the United States most of my life. Came when I was 10, but there are a lot of these idioms that I still struggle with. So excuse me. All right. Hopefully this is helpful. Stay tuned for my next video.